Good afternoon, everyone. Thank you for being here and being so timely in our time together today. I am Michael Munson, and I'm really glad that you are all here with us. On this end of the screen, or on this end of the screens, is also Laurie Cook-Daniels, Forge's Policy and Program Director, and Caleb Weinhardt, who does all of those things that we don't know how to do, or that Caleb knows how to do better. So that is who is on our end. We are really thrilled that you're here, and we have a really packed 2 hours worth of time today. So I'm going to get us rolling. Most of us know about Zoom, but if you need any help with Zoom, please reach out to Caleb through the chat, and he will be glad to help you figure out how to rearrange your screen or access different parts as we move along. So our agenda today is fairly simple and straightforward. It's what we were advertising this webinar to be. And that is, we are going to talk about ACES. We'll talk about lifelong histories and how that impacts health disparities. We'll look at trans-specific ACES, so the things that probably most of you are here to hear about the most. We'll talk about disrupting the ACES. So how can we make changes in adverse childhood experiences to make life better for young people and old people who are trans or non-binary? We're going to end then with some resources and some Q&A. The couple of ways that we'll interact today are through chat. So if y'all want to find that chat box, which many of you have, that is super duper, and you can enter your name, where you're from, what your pronouns are, say hello in the chat to your fellow folks who are watching today. The second way that we're going to interact is through a shared Google Doc, and it's kind of fun. It's actually very fun. So we'll be creating some things together near the end of our time today. So if you have a laptop or a tablet or something that's larger that you can type on or write on, that would be helpful for you to participate in that piece. A reminder to all of us to take care of ourselves today. Many of us work in trauma and healing, but sometimes it's still difficult to hear topics that are sensitive and raw, and the world is really hard right now. So please take care of yourself. You can feel free to leave and know that you will be able to see this webinar as an active recording, an archived recording later on. So feel free to participate or not at your level of comfort. And I'm going to turn things over to Laurie to share a little bit about who she is and to get us rolling about who Forge is. Laurie, you need to unmute yourself first, please.
I tried. Hello, I'm Laurie. We wanted to take just a few moments to share with you a little about who we are and who Forge is. I'm Laurie Cook-Daniels, Forge's Policy and Program Director, and the curator of much of the materials presented in this training. And Michael Munson is Forge's Executive Director, co-founder, and primary trainer. Just a quick bird's eye view of Forge. Forge is a trans organization, 100% funded to focus on anti-violence and health issues. We were founded in 1994. The majority of our work is national, although we do offer some direct service to trans and non-binary survivors in Wisconsin, where 3 of our staff work. We work primarily with victim service providers, about 75% of our time effort, and also with trans and non-binary survivors and loved ones. Forge's mission is to reduce the impact of trauma on trans and non-binary survivors and communities by empowering service providers, advocating for systems reform, and connecting survivors to healing possibilities. Forge strives to create a world where all voices, people, and bodies are valued, respected, honored, and celebrated, where every individual feels safe, supported, respected, and empowered. The services we offer professionals include training and technical assistance, which can take the form of one-on-one conversations, publications, trainings, conference workshops, webinars, and site visits. We also consult on policy issues, take part in collaborations, and give out information and referrals. We have online support venues, including a deep expansion of our social media on a blog. We have publications that include long-form guides, shorter articles, and fact sheets. We go to conferences a couple of times per year when we're all allowed to fly across the country. All of our work is focused on empowerment, and we provide information and referral working with direct services providers. Our staff is small, but we've got a large vision. In all of our work, we are guided by two principles: being trauma-informed and being empowerment-based. We work on both of these values with both service providers and trans and non-binary people. Before we dive in, I wanted to share our social media contact info, since many of you also use social media as your main way of sharing information with other organizations and your constituents. Please find us on Facebook, Twitter, Instagram, and YouTube. We also have a few closed groups on Facebook for survivors as well. If you are live tweeting today, we'd encourage you to use the hashtag #TransACES. Before I turn it back to Michael, I want to thank the National Library of Medicine, National Institutes of Health for the funding for this webinar. Michael.
Thank you, Loree. So I wanted to just make sure that we've got the stage set a little bit, you know, a little bit about Forge. So hopefully that gives you some confidence or not confidence in who we are and what we have to share with you. So we are not going to be talking about 101 concepts today. So we know that you all have access to many opportunities to get 101 information. So we're going to be kind of focusing more on the 201 of looking at adverse childhood experiences and the relationship of trauma to health. One of the things that we're always asked, and this is just going to be a very brief review of some of the data that will help ground us today, is, you know, people ask, well, what is the volume of trans people in our country? And research tells us a lot of different things, that it's someplace between 0.6% of the population and over 1% of the population. So it's someplace in between there, or maybe a little bit higher, or maybe a little bit lower, depending on where we are and what population exactly we're looking at. We tend to use the 1% number because it's a number that we feel is pretty accurate. It's kind of in the middle of some of those ranges, and it's really easy for math. And I'm noticing that once again, my PowerPoint has not included all of the labels that it's supposed to include, which I don't know why that happens. So the two areas that you're not seeing include trans women, which is 33% of the sample size from the US Trans Survey. And then trans men, the other part that's not labeled, is 29%, which are the trans masculine folks. But what's important about this slide is when we're looking at the 1% of the population that's trans, the largest piece of the pie is 35% of folks who are non-binary. And this is really important when we're looking at victim services that are oftentimes gender segregated, or groups that develop that are gender segregated as well. So we want to think about, you know, who those non-binary folks are and where they would fit into a sex segregated or gender segregated environment if that's what our agencies are developing. When I said that, you know, it could be higher or lower than 1%, we are seeing a growth in the numbers of trans youth, or the youth that are identifying in ways other than in a binary way of male or female. So we're seeing more and more trans youth, and it may not be because there are more, but it's because our world might be more allowing and accepting and encouraging of young people coming out at an earlier age. A couple of victimization stats to just ground us in what we're looking at today, in part, are the rates of sexual violence and intimate partner violence. So trans and non-binary folks are experiencing higher rates of both intimate partner violence and sexual violence. Multiple studies that have been collected estimate and kind of confirm that around 50% of trans people experience intimate partner violence, and more than that experience sexual violence. Again, studies are studies. We can look at many of them, and some are going to be higher and some are going to be slightly lower than this. When we look at the gender vector, so folks that were assigned female at birth, folks that were assigned male at birth, and are journeying in their gender in some way, one of the things that we notice a lot is that many service-oriented organizations only focus on trans women or people who are assigned female at birth. And what we want to have you remember and take home with you is that when we've looked at research, when we've done our own research, we've found that sexual assault, intimate partner violence, adult sexual assault, and stalking, the rates are about the same, almost equal, for transmasculine folks and trans feminine folks. This data is also from a survey that we did in 2011, so it's 10 years old right now, but it's still pretty darn valid. We looked at how many people checked the boxes, literally checked the boxes of intimate partner violence, stalking, dating violence, adult sexual assault, and childhood sexual assault. And we were really surprised that so many people had checked so many boxes. So this slide is just a representation of how many people, for example, checked stalking and childhood sexual abuse. So when they've checked both of those things, it's 84% or 64%. So it's multiple things that people are experiencing over the course of their life. And we, of course, want to recognize that when there are other factors involved, those rates of polyvictimization can increase or decrease. The rates of experiencing sexual assault or intimate partner violence may increase or decrease. And the services that people are able to access might increase or decrease. When we add in things like race or socioeconomic status or sexual orientation or religion or any of the pieces of intersectionality that will affect either a positive or a negative outcome. Wanted to just do a quick reminder about pronouns because I feel like I'm not doing my job if we don't mention pronouns at some point in time. So we know that pronouns are really important for respecting who folks are. So these are just a couple of examples of how you all and how we all can integrate pronouns, whether we are asking people directly by sharing our name, you know, hi, I'm Michael, I use he, him, and his pronouns, and asking folks what their pronouns are, or we can have things on our name badges or a button that shows what our pronouns are. So if you're not fluid in multiple pronouns, we encourage you to find references that will help you with conjugation and remembering some of the more atypical pronouns that some folks are using. So I'm going to turn things back to Laurie to talk about the foundations of ACES.
So finally, we're moving on to the ACES. One of the most obvious facts that jump out at anyone who is working on violence and trauma against trans and non-binary folks is that as a group, we experience higher, and in some cases, much higher rates of sexual assault, intimate partner violence, hate crimes, mental health problems, especially depression, anxiety, and suicidality, and substance use issues, to name just the top issues. One reason our rates are higher is a phenomenon that is well known among those who work with crime victims. Once someone has been victimized in any way, they are more likely to be victimized again. As Michael said, this is called polyvictimization. Even though polyvictimization happens to crime victim populations across the board, Forge has been interested in looking at the particular pathways that lead to those higher than usual victimization rates among trans and non-binary folks. And that's what led us to the ACE studies. Abuse and trauma in childhood has far more lifelong effects than most people understand. A long-running study that is backed by the US Centers for Disease Control and Prevention, called the Adverse Childhood Experiences, or ACE study, has clearly demonstrated that childhood problems lead to lifelong effects. This study began in the 1990s and has since been replicated on tens of thousands of respondents. Originally, the study looked at 10 types of adverse childhood events: physical, emotional, and sexual abuse, physical and emotional neglect, and parental or household issues such as mental illness, mother treated violently. This study began before many people were willing to admit that fathers might also be abused, divorce, incarceration of a parent or relative, and substance abuse by a parent or other adult household member. The way the study was designed, adults were given 1 point for each type of ACE they had experienced as a child, leading to scores ranging from 0, the person had none of the designated adverse childhood experiences, to 10, the person had experienced them all. Researchers then looked at the health records for these adults. The following health risk outcomes have been measured against people's ACEs scores. They looked at behavior risk outcomes such as lack of physical activity, smoking, alcoholism, drug use, missed work. They also looked at physical and mental health outcomes such as severe obesity, diabetes, depression, suicide attempts, sexually transmitted diseases or infections, heart disease, cancer, stroke, chronic obstructive pulmonary disease, and even broken bones. What they found was a remarkable and remarkably consistent pattern. The more ACEs someone had scored, the more likely they were to experience those risk factors and diseases. For example, here's a chart on how ACEs relate to adult alcoholism. For those who have 0 ACEs, about 3% will become alcoholic in their lifetime. If you have 1 ACE, your risk goes up to about 5%. 2 ACEs, your risk goes up to 10%. 3 ACEs, your risk goes to 11%. And if you have 4 or more ACEs, your risk of becoming an alcoholic goes up to 16%. This is just a representative chart. Nearly all measured health problems have the same stepwise progression. The more ACEs you experience as a child, the higher your risk for the various adverse health outcomes as an adult. Here's how the researchers think the problems develop. Children who have adverse childhood experiences need to spend time and energy focusing on surviving whatever bad things they are experiencing. As a result, they miss out on some of the optimal social, emotional, and cognitive development that children who are not distracted by trauma experience. Those social, emotional, and cognitive impairments lead to social problems. Children may withdraw, not be good at making friends, fail at school, and experience other types of problems. Those social problems lead to the adoption of health risk behaviors, such as substance use, sexual risk-taking, overeating, and other behaviors that are how many of us try to cope with difficult emotions. Those health risk behaviors, in turn, lead to disease, disability, and even more social problems, such as being arrested for driving under the influence or getting involved in domestic violence or a street fight. And all of those, in turn, can lead to earlier deaths, which has also been amply documented by the various ACE studies that have happened. One of the standout facts of the ACES study is that lesbian, gay, bisexual, and transgender people have higher ACE scores than non-LGBT people. For example, you can see that 58% of the general public has an ACE score of 1, but 91% of trans people have the same score. 20% of the general public has an ACE score of 4 or more, compared to 70% of non-trans LGBT people. Vincent Felitti noted in his seminal work, The Relationship of Adverse Childhood Experiences, that, quote, adverse childhood experiences are the main determinant of the health and social well-being of the nation. That's a profound statement that we can let sink in a bit. In the Journal of Psychiatric Research, authors noted that transgender participants reported emotional abuse, physical neglect, and emotional neglect more frequently compared to cisgender LGBT people. We'll be talking more about the ACES study, but let's take a moment here to talk about the All of Us research project. Important as the ACES studies are, there is still so much more we need to learn about the health of LGBTQ people. Perhaps the most ambitious research project is All of Us, which is a longitudinal study being conducted by the federal government that seeks to enroll 1 million participants. What is most important for you to know is that all of us is making a major sustained effort to enroll understudied population, and that very much includes LGBT people. Forge has been part of the project for several years now, and we are delighted to share the study with you and encourage you and your friends to enroll. This next video helps explain the project.
The All of Us research program is an ambitious effort to gather health information from 1 million or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
When I came out, I didn't feel comfortable, I didn't feel safe, and that was a very hard place to be.
Coming out as lesbian, gay, bisexual, even now transgender, it was hard to do that. And so because of that, whenever you went in to see a doctor, you were too afraid to really actually say who you are.
The biggest obstacle, to be honest with you, and simply is this trust, right? Trust from the community on not being misgendered, not being mistreated.
The health community, healthcare, they didn't get that. At that time, they felt like everything is one fit, that no matter what happens to one community, it's going to happen exactly the same thing to the other community. And that's not the case.
The lack of data has been a major problem for a number of years. It's really only been in the last 10 years or so that the big health systems, the surveys that go out to people nationwide, have included any questions about sexual orientation, and only a handful of them have any questions about gender identity.
Oftentimes what happens, particularly within communities that don't feel safe within a medical field, is they'll prolong and they'll wait and they'll say, it'll get better, and then by the time they go to the doctor, it's so late.
My family has had issues like high blood pressure, diabetes, so I'm very mindful of that and really trying to do everything I can to resist that.
One of the things for me that I have to be careful of is, my heart. My mom died at a very young age, at the age of 43, of a heart attack.
What I really appreciate about all of us is really taking this approach to make it inclusive of as many people as we can.
We'll have the information from 1 million people, people of color, LGBT people, people from diverse communities, to tell us about themselves.
To get their biological information into the database so that there's more information to work with when trying to develop new ways of treating people and treating those disease processes.
That's the only way we'll be able to find out and understand whatever that we need to do to take care of ourselves.
That's a call to be honest and open about being LGBT. It's really a much broader call to stand up and be counted. All of us being seen will give us hope.
Michael, can we turn it over to you?
Sure, I can go from here. So we're going to move next into lifelong violence and health disparities. So just a couple of slides on this before we move into kind of comparing ACEs with trans realities. What we know is that trans and non-binary adults experience higher rates of multiple types of violence. So we started out with some data slides about sexual assault and intimate partner violence, but we also know that trans and non-binary folks are experiencing hate-related violence specific to being trans or LGBT or T or non-binary. We also know that trans folks are experiencing higher mental health challenges, so depression, anxiety, suicidality, and we're going to talk a little bit more about each of those pieces as we move on, as well as the rates of substance use or abuse that happens more frequently among trans folks than non-trans folks. We know too that 3 times more trans folks experience sexual abuse in the recent past. So when we look at the past 12 months, trans children are experiencing 3 times more abuse than their non-trans peers. We can also look at trans kids and how they feel safe or unsafe in schools. So we know that trans kids are much more likely to feel unsafe in the last 30 days. So like more than 3 times of trans kids feel more unsafe than their non-trans peers. And the same is true for when we look at kids who are fearful of or are being threatened or injured at school with a weapon. In this day and age, with so many screenings of, for weapons and metals, it's kind of surprising that weapons are actually getting into schools or on the playgrounds or other areas. But trans kids, as well as other kids, are experiencing that violence from weapons. We're going to talk about suicide in several different ways today as one of those health disparities. But when we look at trans kids are, attempting suicide as well as trans adults. So around 35% of trans youth have attempted suicide, and that's compared to 7% of non-trans youth. So that's a lot of times higher. That's 5 times higher. And the trans kids are also seriously contemplating suicide, even if they haven't made a suicide attempt. So again, much higher rates for trans kids than non-trans kids. So this next section is going to kind of juxtapose some ACES data from the large data collection of ACES nationwide. And it's going to compare that or look at the data that we know about trans folks. For some of these things, we're going to have kind of a one-to-one direct correlation. And for some things, we're going to have kind of a mismatched, but kind of related. And you'll see that as we move along. So we're going to look at smoking first. And when we look at smoking, the graph on the left of the slide is the fully, the US population who have taken the ACE study, the ACE survey. And you can see that smokers, it's increasing over the amount of ACEs that they've experienced. So people that have 0 ACEs, people still smoke, but it's at 6% versus folks that have 5 or more ACEs where the rate is 16%. So again, like Larissa said, we're going to see that natural kind of slope. More ACEs somebody has, the more likely they are to experience this particular health effect. When we look at trans folks, the range for trans folks of smoking is between 30 and 45%. So, and it's a range because the data can look at some multiple factors that are in there in multiple studies. So when we're looking at trans folks, it's double the highest on the ACEs of the non-trans population. We can look at alcohol and drug use. And for those of us who work with survivors of sexual assault, domestic violence, and other forms of crime, we know that substance use is really common as a coping strategy, both with former abuse, past abuse, or with current abuse. So it's not going to surprise us to see higher numbers of folks that use alcohol because trans folks are experiencing higher rates of victimization. So when we look at that general ACE study, we can see again that curve that goes upward with more ACEs. And the highest number that's on that generalized population is 14.5%. When we look at trans folks who are using alcohol or drugs, that rate is someplace between 26 and 47%. So again, double or triple what the general population is. We can look at things like missed work. So this is another one of those things that is a result of having higher ACEs. And we don't have good comparative data here. But what we do know from the US Trans Survey, for one source, is that trans people do a lot of things to either try to maintain their employment, to try to cope with workplace discrimination. And I'm not going to read off the slide. You're going to get the slides afterwards, but there's a lot of things that people do to try to maintain their employment and stay as a working human being in this world to try to have enough money to live. We can project why trans folks might be missing work probably more often than non-trans folks. And some of those reasons are about employment discrimination. So there's no national employment discrimination laws currently on the book. We're all hoping for that, I think, but it's not there yet. There is clearly anti-trans and anti-LGBTQ harassment in the workplace, whether it's legal or not. It's not legal, but it still happens. We know that things like minority stress, which we're going to talk about in a little bit, are really affecting of people maintaining their job and going to work. We also know that we just talked about alcohol and drug use is a little bit higher for trans folks. And when people use alcohol and drugs, they may oversleep in the morning and not be able to get to work. We also know that trans folks are oftentimes employed through low-wage jobs or jobs that are physically demanding. And so people may get sick more frequently. They may feel like they have to go to work because, you know, no matter what, they have to go to work because they have to pay their bills. So there's kind of this juxtaposition between, I don't make very much money, so I have to keep on going to work, even if I am sick, or the work environment is really harsh, and therefore I might get sick and need to not be at work. We know a lot of things about what happens in terms of this kind of, we can look at the school and the prison pipeline kind of direction of things. When people drop out of school, which is common for many trans folks, they may not be able to get a job. If they get a job, they may not get a job that pays them well. That can all lead to things like isolation. They don't have, you know, peers in their work or peers elsewhere maybe. That can lead to increased depression. We can look at those economic disparities and realize that when people are not making money through work, they may not have stable housing. They may not have stable food. And that may lead people to engage in things like the street economy. So through sex work or selling other things that may be legal or not in order to have a roof or food. We also know that some of these challenges lead to folks getting weapons and acquiring weapons to maintain their safety. And that can be involved in work or involved in school, as we saw with weapons coming to school. It can be involved as law enforcement won't protect me, so I need to protect myself. And we're showing pictures throughout today's time because of a couple of reasons. One is sometimes people have said, well, I don't know who trans people are. I don't know what trans people look like. And my comment to that is always, well, trans people are everywhere, all around us. So this is just an overt reminder of that trans people are all around us. Trans people are resilient. Trans people can be and are survivors of violence and can still be resilient. So I hope that you'll take a moment with me as we see some of these images throughout today. So let's go back to the ACES and look at the lack of physical activity and severe obesity. So that's their language of those two pieces. We don't have good trans data on either of those two things. What we do know is that depression and anxiety can lead to inactivity and or overeating. So those are some coping strategies of living with anxiety or depression. We know that when people don't go out or don't go out in public, they may have access to less healthy foods. They may not go out in public to go to a gym or to go walking. So staying at home is going to affect their activity level or their weight. We know that folks that are lower income or who are on some forms of assistance may not have access to healthier foods. So they may not have access to as many fruits or vegetables or lean proteins, and so may eat more higher fat content foods or higher carb foods and thus gain more weight. So we've talked a lot already about depression and suicide, but let's again compare this with the generalized ACE data and look at what it's like for trans folks. So when we look at the ACE data, again, you know, when we look at these folks across the country, multi thousands of people have responded. You can see that chart again slopes up with more and more ACEs. So at the top of this chart from the ACEs is 35% with folks that have 7 or more ACEs. When we look at trans folks, that rate starts, suicide attempt rate starts at 40% and can go even higher. And I will show you what the higher numbers are with some of the intersections that create those higher rates. So again, we can look at general population, which is around 5% of the population will attempt suicide at some point in their life. When we look at the US Trans Survey's kind of global population of trans folks, it's 40%. So it's kind of our baseline. When we add in the folks that have experienced sexual assault, that rate goes to 64%. Intimate partner violence, 65%. And it's interesting that the bottom two, the highest two factors are sexual abuse from a teacher and physical abuse from a teacher. So we can have rates up to 76% just looking at those types of victimization and being trans. So we can say that there are, higher rates of suicide and depression, and there can be lots of factors for that. Trans people are not born with inherent depression and anxiety. Those things come out of things like abuse, comes out of discrimination that's across our country and across our world. It can also come from a lack of access to mental health services. So again, if folks don't have a job that has insurance, they may not have health insurance at all and may not be able to access those services. And again, widespread discrimination really contributes to folks feeling depressed or anxious or many other things that are clumped into the mental health kind of group of things. The next piece that we're going to talk about with ACEs is sexually transmitted infections. And we don't have good comparative data here. So this is going to be one of those mix and match points. So the ACES study talks about risky sexual behavior, and they talk about STIs. So you can see, again, the chart continues to go up. What I'm going to compare it to here, and it's not a good comparison, is the rate of sex work among trans people. This is not necessarily a risky sexual behavior, but it does put trans folks at more risk of sexually transmitted infections if they're having more sex than an average person who's not doing sex work. So 19% of trans folks are engaged in sex work, again, to meet basic needs and because of employment challenges. What we know about trans folks and HIV is that there is a huge difference between the general population, whose HIV rate is around 0.5%, to trans women, where the rate is 42%. And that, again, can be, there's a fluctuation with that 42% based on race, based on urban or suburban or rural, but that rate is profoundly different. Trans men and non-binary folks also have a higher rate than that 0.5% general population. And there's a couple of reasons that I'd just like to share about why those rates might be a little bit higher. And I see that somebody's asking about PrEP, and let's talk about that in a second as well. The rates might be higher because people who are trans may feel unlovable and like, I can't ask somebody to wear a condom or engage in safer contact with me because they already are stretching to love me anyway, so I can't ask for more. We know that sex education is not super great in our country, and a lot of times there is no contact or no content that's about trans folks at all. So trans folks are not learning about protection from school because it's not being taught. We're going to leave aside what's happening in our country now, but there's a lot of stuff that goes into where lack of education is. People with sexual assault histories might believe that was an educational event. And that's kind of hard for a lot of us to believe, but many folks who have survived sexual assault think that is what traditional, normal, healthy sex is. So if we don't disrupt that pattern, that belief set is going to continue. We already talked about rates of sex work. The other piece is that trans bodies might not fit typical forms of barrier protection. So bodies may not work well with condoms or with dental dams. And so somebody in the chat who mentioned PrEP, one of the really good, positive, resilient things going on right now for trans folks is that PrEP and other prophylactic measures are being talked about a lot. And a lot of trans women in particular are getting access to free PrEP. So that's a really good thing. And hopefully we'll see those numbers of HIV infections going down. So I'd like to show you a video next, and it relates to our conversation about HIV. And this is a really beautiful story from Jada.
I would tell HIV that you have been the greatest teacher I've ever had. You've taught me so much, so many positives and so many negatives, but you've also taught me that I'm more than I think I am, and I can accomplish more than I give myself credit for. When I found out I had HIV, I was 1 week from turning 21, and I felt like my life was over. I kind of felt like it was time to die. I didn't tell anyone. I didn't go into treatment, and I had been in shock. I was scared. Getting into care has been a really wild experience. From when I first found out I had HIV up until now, you know, I've been back and forth with treatment, but recently it's been the longest stretch. It's been almost 10 years now since I've been on treatment, and I've transitioned within the last 5. I continue to see this fabulous doctor because she works with me. If I say that there's this or that needs to be addressed, she focuses and she gives me the attention that I need. She talks about different things with me without stigma, without judging. And I think that's very important. I'm very open. I've learned a lot. Even through transitioning with my medical provider, she's been ultra sensitive and very helpful in this transition. Something that motivated me to stay in care was when, after a couple of years, my T cells were over 900 and my viral load has been undetectable. It made me feel empowered. Something that I would tell a trans girl who is hesitant to start treatment is don't wait until your body has disintegrated. Don't wait until your immune system is so fragile that some can sing and break it. Don't do it. It's so hard to recover. I would tell a trans girl who's coming into herself, finding out she had HIV, darling, it gets nothing but better. If you can look and use me as an example, use me as your support, we can accomplish this. Living well means living, not waiting for, oh, I'm gonna do this and I'm gonna do that in my life. I have made it a point to live. I'm gonna rock it out and I'm gonna live it to the max. That's what living well means to me. HIV treatment works. Get in care, stay in care, live well.
So Jada is really fantastic. I had the privilege of meeting her once, and her last couple of lines about, with that really gruff kind of like living well is really what she embodies. So I think she's got a few more videos around, and I welcome you to go find her and listen to her some more. So the next group of these health outcomes are diabetes and heart disease and cancer, stroke, COPD, broken bones. This whole collection of things that normally we think of like, how does childhood trauma have anything to do with these things? We don't have a lot of trans-specific data on those things and how that, and trauma. So we just don't have a lot of trans-specific data. But some of the things that we do know are that trans people avoid healthcare a lot. So someplace between 20 and 31% of folks avoid healthcare out of fear of being disrespected or mistreated. You can see there's a breakdown below that of folks who are non-binary, folks who are trans women, folks who are trans men. The rates are a little bit different, but the point is that people are avoiding care out of fear of being disrespected. And there's really good reason that people are fearful of healthcare providers and what's going on and why they may not seek healthcare. And some of those reasons are that like 24 to 42% have experienced negative interactions with healthcare providers. So if you had a negative experience with a healthcare provider, you're not likely going to go back to that provider or maybe even any other provider. So we've talked a lot about data. So I'm going to encourage us to say, oh my gosh, that was a lot of data in a short period of time. And so I encourage us, if you feel like taking a breath, hopefully you're continuing to breathe anyway, but take a breath or stretch, or just take a moment to shift from the really heavy data that we just shared. We're going to talk a little bit more about heavy data, and then we're going to look at some resilience factors. All right, so hopefully everybody has taken a breath if they want to, as deeply as you want or not want. And we are going to now move on and talk about trans-specific ACEs. And Caleb's going to help me with this section by reading some of the quotes. We're going to share some data. We're going to brainstorm first. We're going to share some data. We're going to look at a quote, and then we're going to look at a resilience factor, either of trans folks or of the people around folks. So I see that the chat has been active. We are going to first use the chat some more to think about this question of what are some other types of ACEs that trans people might experience? So we've listed out these ACEs, we've talked about these ACEs. What are some things that might be specific in childhood for trans people that would be traumatic? So if folks want to add to the chat, and I'm probably not going to be able to keep up because of how many folks are here. Bullying, yes. What other kinds of things might trans people? Conversion therapy, exactly. Family rejection, parental rejection, and I'm not going to be able to keep up. Shaming by parents, religious exclusion, spiritual abuse, invalidation, body shame. I'm sorry for our ASL interpreter. I'm going to let us kind of watch this and take it in. I'm just going to wait for a couple of minutes to let people keep on going. So transphobia from parents, classmates, religion, experiencing homelessness, human trafficking, lack of acceptance, chronic trauma, denial of autonomy. Yeah, those are great generative list. Religious trauma, erasure, severe dysphoria, grief, self-rejection from lack of modeling. That's an interesting concept. Shaming, excellent list, y'all. That's really great. Yeah, we're going to talk about some of those things because you all have gotten it right. You're on the totally right track, and all of those things are true. So we're going to talk about a few things that we've identified that seem to be pretty common trends among trans people that have a negative health impact. So we're going to start with bullying, which I saw several times in that list. So one trans-specific ACE that Forge has a belief in being true is around bullying. And that bullying, as many of you had noted, can be at school, it can be at home, it can be in our neighborhoods, it can be on the streets, it can be in extracurricular activities. So, that can go from any place from the church or synagogue to playing soccer to any place that child, that kid is moving through the world. Any of those places can have bullying experiences in them. I wanted to share just a couple of examples, and I'm sharing examples about bathrooms, not because we all need to talk about bathrooms all the time, but it's a really serious thing when kids cannot use the bathroom that aligns with their gender. So from a bunch of different kinds of research, we know that 60% of trans kids have been forced to use a bathroom or a locker room that doesn't align with or doesn't match their gender identity or their gender presentation. That's a lot of trans kids. So what does that do to their self-esteem? What does that do to them as kids who we would want them to be vibrant and whole and healthy? They go all day without peeing. Excuse my language of that, but this is what happens when we deny access, and that can then lead to things like kidney disease and other things that are more serious. About half of all trans kids are called by an incorrect name or an incorrect pronoun. Again, how does that make trans kids feel? How does that shape their learning environment? 28% of trans kids are not allowed to wear the clothes that they prefer. That's the language of the study, not me. So that clothes that don't align with their gender. So, people that want to wear skirts or people that want to wear makeup or people that want to do the things that express who they are, that's not allowed in almost 30% of trans students' lives. Caleb, could you read this quote?
I have encountered verbal harassment in the bathroom and people peeping into the stalls saying, "Look, it's a girl," and other similar incidents that made me feel unsafe.
Thank you. So one of the ways that we can build resilience, so we're talking about bullying, how do we build resilience around the fact that kids are bullied? The picture on the slide, I'm going to explain some of the pictures today, are two non-trans teachers who came to a rally that a young 17-year-old high schooler created in response to some of the actions under the former administration when there were some rollbacks in federal legislation that were anti-trans. And this 17-year-old got all of these people together and created this rally, and every single one of that kid's teachers showed up for this rally to protect and support trans kids. And many of the teachers had signs like the ones that are in this photo, which say cis or cisgender teachers supporting trans youth. So we can build resilience by showing up in these places and building that social network and the fabric that says you matter and you're not going to be bullied in this space and this time. The second one was denial of identity, and I saw that as well when the long chat was streaming in. So We can have denial of identity in many different ways. Oftentimes we think about it from parents, but it can be a denial of identity from teachers or coaches or religious or faith leaders. It can be from anybody. And what does that do to a kid who is told you're not who you say you are? You're not who you are. That can be really difficult to be constantly told that and try to be shaped into something that you're not. And I wanted to share a little bit about some common parental responses. So parents who are loving parents will say things like, well, it's just a phase, or he'll grow out of it, or how could she possibly know that she's trans, or, he's just confused, he's not really trans. And so it's not really that parents don't love their kid or want their kid to be happy or whole. They just believe that it's a phase. Sometimes parents think that not talking about things or discouraging things through adolescence will kind of negate their trans identity. And one of the things that parents do sometimes to try to protect their kids and to try to protect their families is to not allow their kids to attend family events or social events. So kind of literally isolating that child from the events that help keep them healthy and whole. So again, well-meaning parents will do things to try to help their kids have a good life. So that might mean that they try to change their kid's gender identity, believing that the kid will be happier and more whole. Some people might feel ambivalent about their trans kid, and that could be at least in the beginning when their trans kid shares that they're trans with them, or it could be any point down the line. Parents may feel that they don't want to condone or encourage trans identities. And again, all of that is coming from a well-meaning place because the world is pretty hard on trans folks. So why wouldn't a parent want their kid not to feel the weight of the negativity of the world? That protection that the parents are trying to give, though, feels like rejection for that trans youth. So the youth is not hearing the love or the kindness of the parent who's trying to protect them. They're hearing mom, dad, grandma, whoever the adult is in their life is rejecting them. So some of this data is from Caitlin Ryan and the Family Acceptance Project, and we've talked about these things. So Caitlin Ryan has codified it in different sets of numbers with what people who are feeling rejected, what those things lead to, like 8 times more likely to attempt suicide, more likely to experience depression, more likely to use drugs, more likely to be HIV positive or have an STI, those things that we already talked about. So it's just looking at it from a different perspective.
When my daughter was little, I spent so much time fussing over how she looked. I should have been concerned about how she felt. We didn't know about transgender, but I know how sad and depressed she got right before middle school. The school helped us find a counselor, and that's when we found out how hopeless she felt. I wanted to make sure she wasn't rejected by others, but instead I was the one who was rejecting her. I'm so grateful I could change things before it was too late.
Thanks, Caleb. So this is a parent who the light bulb went on at a point, and that's really great to see. And we're seeing that a lot. A lot of parents are accepting and engaged with their trans kids or non-binary kids from the get-go, and some take a little while to get there. And unfortunately, some never get there. But these are positive stories that say, we can get there. We can get there. Conversion therapy, though, still happens. People that want to try to change somebody's identity, that still is going on. I think some of us think that that is an old thing, that it doesn't happen anymore. We don't institutionalize people. We don't try to change someone's sexual orientation or gender identity. We don't know the exact number of trans folks that have been involved or forced to be involved in conversion therapy, or you can call it a lot of things that are probably more accurate than conversion therapy. But there are a lot of LGBT folks that are still experiencing that. And it can have a lot of consequences. Let me show this video, which is a great video made quite a few years ago, but it's a really interesting video about conversion therapy.
So reparative therapy, you might also know it as conversion therapy or ex-gay therapy or sexual orientation change efforts, is a series of these dangerous and completely discredited practices engaged in by mental health practitioners trying to change a person's sexual orientation or gender identity.
It's an absolutely devastating experience for a young person to go through, and most of the young people who are subjected to that suffer lifelong, really permanent damage.
And they will subject these kids to these awful, awful treatments that in the past have ranged from electroshock therapy to nausea-inducing drugs that now are primarily talk therapy, but that still, even when you take the electroshock therapy out of it, they result in substance abuse, they result in depression and anxiety, and a lot of the times they result in suicide, and we have lost way too many of our survivors along the way because of it.
That's why we are so grateful to have a chance to work with survivors like Ryan Kendall, who somehow managed to survive, not only survive that experience, but to turn his life around completely, going from being, homeless, living on the streets, completely separated from his family with very bleak prospects for the future, to he was just so determined to not let that experience destroy his life. And he was able to go to school. He's going to law school now. We're so proud of him, and he has worked with us to pass the first law ever in the entire country that bars therapists in California from trying to change a young person's sexual orientation or gender identity. He's now helped us to pass a similar law in New Jersey, and we are working on other state laws in an additional 20 states now. Thanks to Ryan and our partnership with him, we're really changing the country on this issue.
It takes years, sometimes decades, sometimes a lifetime before people can actually come out and talk about this. Sam is somebody who is willing to get up in front of a room full of people and tell a story that I cannot imagine having to relive as often as Sam does, with vulnerability and humor and genuine sweetness and willingness to connect to an audience that might not always know how to ask the right questions, that might sometimes make it worse. Sam is willing to put themselves on the line, and honestly their own well-being on the line, to make sure that these people know what happened, know what still happens, and are engaged and committed to making sure it doesn't happen again. Sam is also an MIT student in nuclear engineering technology. Sam has never let what happened years ago be the defining factor. Sam is a force. I cannot wait to just keep being a friend, keep being a colleague, and keep watching what happens to the world as Sam grows up in it.
So as somebody just posted in the chat, which I was going to mention, Sam is now part of the Biden administration in the Department of Energy. So things that are hard, and Sam went through a lot of really hard things. Sam is just resilient as can be, and it's really, really cool that this person is now part of the federal government in the White House doing things in this administration. So way cool. So that shows a little bit about resilience. I mean, Sam should be our resilience photo here, but some of the other ways that we can help folks be resilient is to really see people's wholeness. So to not try to convert people into something that they're not, but to see people as they are, see people's wholeness as they are. So the third trans-specific ACE is around expulsion from home. So in our brainstorm before, many people mentioned getting kicked out of home or getting kicked out of school. So that is definitely something that we see as a trans-specific ACE. When we look at housing instability for youth, when we look at cisgender youth or who are LGB, so lesbian, gay, or bi, housing instability affects about 25% of LGB cisgender folks. For trans folks, it's not quite double, but it's at 38%. So there's a bunch of folks that are young and don't have a stable home. And that's tough. That's really tough. When we look at across the lifespan, so not just youth, but youth and adults, 1 in 5 trans people or non-binary people will experience housing insecurity or homelessness at some point in their life.
I haven't had a warm place to sleep for 3 weeks. The only food I've had comes from grabbing food from my tricks houses.
Thanks, Caleb. And so some of the resilience that we can offer, let me just go back to the previous slide. Some of the resilience that we can offer is if we're a victim service agency, if we're a therapist's office, one of the things that we can do is have snacks available, right? So if folks are experiencing homelessness or lack of access to food, we can try to engage in our services and our service delivery in ways that help provide food or nourishment or vouchers for a warm night's stay. So if we go on to kind of the pre-recorded view of resilience, we can look at how can we foster healthy relationships? How can we look at healthy relationships where we don't kick people out of our homes, even if we don't like them? We can say, you're part of family, you're part of our home, and this is what's healthy and what healthy relationships look like. We know that police misconduct is a really severe issue, a challenging issue for many people in our country, and it's true for many trans folks. So again, if we put some of these things together, we look at the fact that trans kids are kicked out of their house, might be kicked out of school, might be engaging in sex work or street economy work in order to survive. We know that folks that are on the streets in some way, some part of the time, are going to have more contact with law enforcement. Law enforcement are not necessarily very kind to folks that are living on the streets or engaging in behaviors that are currently not considered legal in our country. So there can be some overt discrimination that's happening by law enforcement. So literally just anti-trans cops who are being anti-trans to the people that are on the street. Or there can be some overt violence from those folks that are feeling those anti-trans feelings, and they're expressing them. So we know that there's obviously multiple intersections here with trans folks and police misconduct and race and age and a whole bunch of things that make it worse for a lot of trans folks.
They referred to me as a female at first, but after they checked my ID, they referred to me as a male. They treated me as a prostitute and told me to leave or else I'd be arrested.
So this is one of the common things that happens, right? So I think trans communities talk about it as walking while trans, or there's stop and frisk laws across the country, even though there's not supposed to be anymore. But one of the things that law enforcement, for example, will do is if they see somebody that they perceive to be trans, they may stop them and arrest them or harass them, believing that they're engaging in sex work, even though they're just walking down the street, minding their own business. So there's some police reform that needs to happen around that. And obviously treating people respectfully is another nice critical factor to have involved in this as well. So one of the things that we can do to build resilience is to work for justice. And some of you who may know Bambi Salcedo will know that this is Bambi Salcedo on the screen, and she is just a dynamo and the head of Trans Latina Coalition. And she's been at the forefront of really working for justice in a number of different ways. We can all work for justice, however we choose to do so. So let's look at microaggressions and what they are. Caleb, are you willing to read the next slide about microaggressions? Thanks.
Yes, definitely. Microaggressions are brief and commonplace daily verbal, behavioral, and environmental indignities, whether intentional or unintentional, that communicate derogatory or negative slights and insults, or even some hostility toward a group of people. These words and actions establish, reflect, and reinforce the dominant paradigm, erasing the experiences and realities of a minority.
Thanks, Caleb. So that is a kind of a gobbledygook, really intense, dense paragraph. And so I think a lot of us know what microaggressions are without that many words to explain it. But a lot of times we think about microaggressions are those like little things that kind of sit on our shoulder, those little things that people say that are usually not meant to be offensive or hurtful, but they are. And the next two slides really show what they are. So I can read these, Caleb. So these are just two examples of microaggressions. So the whiteboard that Teak is holding says, "Wow, I would never have known you used to be a girl." So that's a microaggression. Another microaggression example is, "You're so beautiful for a trans girl." So those are two examples. one of the ways that we can foster resilience and build a better world is to call people in when we hear those kinds of things. Some people like to call people out. I'm much more in favor of calling people in, but y'all can have your own style. But if you hear something that's a microaggression or a macroaggression, what would it take for you to be able to say to somebody, hey, could you come in my office? Could you come over here and can we talk about what you just said? Because that was kind of hurtful. And have that conversation, even if it's a hard conversation to have. That can change their minds and change their behaviors so they don't do it again and don't cause harm again. So the next one of the trans ACEs is minority stress. And Caleb, if you're willing, could you read the next slide too, please?
Yes.
Thank you.
Minority stress is the result of observable incidents, vigilance for future incidents, and a person's decision that the incident is related to that person's minority status. As a result, they internalize this process as stress.
So this is one of those things that minority stress is like the big S stress. So not just the everyday stress of like, oh, I've got a lot of work responsibilities or my kid has been crying all night. Well, that's a big stress too. But these are the stresses that get linked to identity, whether it's true or not. We could spend hours talking about minority stress, but it can be really pervasive and really life altering.
I had to end one course of therapy because the therapist suggested my ex had become trans because he was a child SA survivor.
Thanks, Caleb. So that's not exactly minority stress, but it has components of it. And this is just a reminder to us all too that like anti-trans violence or language or comments are not just towards a trans person. It might be towards somebody around that trans person who's getting less quality care because of transness in their life at some place. So what can we do to help resilience? We can help by increasing access to support and healing. The cup, which might be hard for folks to see, Ilya has a cup that says, dear trans people, you have a right to heal. So we want to help create spaces that remind trans folks and non-binary folks, you have a right to heal just like every single other person. So number 6 of trans ACEs is legislated discrimination. And I think we're hearing a lot about that going on in our culture right now, in our states right now. So legislated discrimination can do a whole bunch of things. It can interrupt the learning experience. So we talked about like bathroom access or getting to wear clothes that align with someone's identity. Those kinds of things can really disrupt the learning experience for kids. People might miss out on key developmental skills. And those developmental skills might be learning how to be on a team on sports. I'm not a sports player, but that's where people learn how to play with each other, literally play with each other. If they're not allowed to play in sports together with other kids, what are trans kids learning? They're not learning about teamwork. They're not learning about cooperation. They're not learning about basic move through life skills. Again, no safe restroom, that can lead to lack of concentration. If all you're thinking about is your bladder, you're not going to be able to concentrate on learning algebra or learning, Shakespeare. The exclusion from groups is the same kind of thing as sports, right? If you can't be included in groups, either because of legislation or because of parents who are trying to legislate, that can cause some real harm for young people. And it results in young people just feeling that they can't be themselves anywhere. So they either have to be a false version of themselves in order to access that learning environment and that fullness of the learning environment, or they are just afraid to be themselves and they are themselves, but then they're getting shut out of all these opportunities. So the political climate right now is really challenging, as many of us know. And there's a lot of concerns about trans folks being outed, just again, for being who and what they are. There are fears around things like immigration status, which combined with transness just escalates and blossoms things. There's a big risk of safety for good reason right now. There's an increase in hate-based violence that's happening the last many years. There's concerns about not being treated at all, not being treated well, not being able to access care at all. And in some places, we're seeing some rollback. So we've got federal legislation that was rolled back under the former administration. Those federal protections are now back in place. But what we're seeing now are statewide discriminatory practices or laws, as well as local or local or municipal changes. So some of you are following what's happening in Florida, for example, with like the Don't Say Gay bills, which are not just about gay and lesbian folks, but are about trans folks as well. So that's happening on a state level. So no longer federal, but moving on down. So another state that folks might be watching, this is just an example of one of those political climates, is what's been happening in Texas. And there's been some pauses and starts and stops with this, but the Texas Attorney General wanted to say that transition care, hormone surgery, any type of transition care for minors is child abuse. So right now, I believe we're on hold with that. And so kids can still get trans-related care, but that's a pretty severe thing for somebody to say that children accessing trans-affirming care, life-saving trans-affirming care is child abuse. And again, when we look at the impact of this, the pediatricians who are serving trans kids are getting death threats, are getting threats against who they are as a provider. So again, it goes beyond just trans youth that are getting targeted. It's the folks that are around them who are loving and caring and supporting them. And that's a really not great place that our world is in right now.
Every day, I wake up to my newsfeed flooded with another person killed by police, another new law that takes away LGBT rights, another slew of protests because Black Lives Matter, another set of memes with quotes that real people in government mocking who I am. As a Black queer survivor of police violence, I don't know how much more I can take.
Thanks, Caleb. This was written in a year ago. So I can only imagine, I hope that this person is not still feeling that way a year later, but in a lot of ways, I'm guessing that many people like this are feeling these kinds of things even more now as we're into the pandemic longer and into seeing so much injustice of many different types for so many years. So some of the things that we can do are really to work towards changing laws and legislative initiatives. We can work towards protecting trans rights. And there's a lot of ways that we can do that. We're going to talk about that in a little bit when we start to engage more fully, but we can do that work in a lot of ways to keep trans youth and adults in a better space. And the last, the trans-specific ACEs that I'd like to share with us today is around culture-wide discrimination. So we can look at ACEs and culture-wide discrimination in a couple of different ways. So what's on the screen right now is a hand that says wipe out transphobia. And then on the other side of the screen is this drawing by Leila Alcorn, who did complete suicide several years ago. And she ended her suicide note with "Fix society, please." And so it's I think our directive to, not just from this one person, but she said it really well, right? I mean, we need to fix society. We don't need to fix the trans folks. So what can we do to help change our society in a way that all of us can live relatively safely and be who we are? So I wanted to share kind of an additional kind of juxtaposition of what is going on right now in our culture, in our climate, in the ways that we are legislating discrimination and sanctioning hate. So we're still, I think, living in these three bubbles of pandemics, of COVID, of the economic kind of challenges, which in some ways are getting worse right now, and racism, which is still as strong and pervasive. What I think are also pandemics kind of on top of those things are the legislated hate that we just talked about, and also the sanctioned or emboldened hate. So we have people that are saying things that are just horrible, and then other people are like kind of copying that. They're thinking, oh, well, it's okay for me to say that horrible thing too, because this person that I trust or this person that I look up to, either political or celebrity, is saying these things. That means that I can say them as well. So not cool on either of them or any of them, but those things I think are just adding to the additional layers of what people are living with right now.
News from a 15-year-old boy I tutor. There's a kid in my religion class who I have no idea if they're a boy or a girl. So when I see them, I just call them fam. At my plaintive look of, I don't know if I heard you right, you know, like family. The youth have spoken, and fam is the gender neutral bro.
Isn't that cool? I think that's a fantastic story. So again, one of those things that we can do is just to listen to what the youth around us are saying, listen to what the adults around us are saying. We can mirror that language. We can learn new language. We can create new language with folks. So it's pretty darn cool. So one piece of resilience too, there's the slide of like, we can be kind to each other. And a lot of times in trainings, one of the things that I say to people is like, you know, you can learn all you want about trans folks. You can learn data, you can do like all your research, which is good, right? I encourage that. But if we're kind to people, if we treat people well, we're going to be good. You know, we're going to be culturally competent. We're going to be culturally responsive if we're kind. That's a simplicity kind of way of looking at it, but it's really quite true. So I want to share another video in this section before we move on to some interaction. So you can get your laptops ready. We're going to do a Google document share thing in just a second. This video was created by a Wisconsin trans videographer, and it was made about a year ago, when the Wisconsin legislative actions were trying to stop trans youth from playing in sports. So this is all about sports and trans kids, and it's just a lovely video.
I learned that practice pays off.
I learned the value of hard work.
I became a part of something bigger than myself.
I wasn't great in school, but baseball and eventually softball motivated me to really work hard.
I never played college ball. I never went pro. But through mushing, I got to be part of something.
I learned how to win and how to lose and how to keep going either way.
I grew stronger.
I grew more confident.
I met some of my best friends.
I had fun.
I treasured those memories.
I hope all kids get the chance that I got.
I hope every kid in Wisconsin can be part of the team.
Trans inclusion is important to me. I coach kids in soccer that are gender fluid and non-binary. My kids are on their team, and those are just their teammates to them.
Let kids play, Wisconsin.
Wisconsin, deja a niños que jueguen.
Let kids play, Wisconsin.
Let kids play, Wisconsin.
Let kids play, Wisconsin.
Let kids play, Wisconsin.
I just want to play with my friends. Bye.
I hope that helped shift our mood a little bit. Again, we just went through a lot of really heavy content, and now we're going to move into a place where we're going to really look at some resilience factors, some protective factors, and we're going to do some of this together. So, and I know some people are saying that they're crying. That video is just like amazing, and the data is hard, and there's a lot of space for crying and lots of good things. So we're going to shift next. And Caleb, could you add the HTTP so people can actually click it, which only works with an HTTP, or with the yes. Preface before it?
I was wondering why it wouldn't. Sorry.
Yeah, so we're gonna move to a Google document that we're gonna share. So Caleb's gonna re-put it in there. Zoom is like funky about URLs, and I'm gonna stop sharing this screen, and I'm gonna share the Google document screen. And what I would like folks to do is to go to this screen, and you should all be able to enter. So there's 8 different pages, and it sounds like there's a lot of pages, but there's 8 different pages talking about the 8 different trans-specific ACEs we just talked about. So what I'd like you to do is you can grab these little squares or rectangles and write in what you think some protective factors are around bullying or around any of the things that we just talked about.
Adults who think you are awesome and tell you so. Actually enforcing anti-bullying policies. Make sure that it's not punitive, but attempts to understand what is motivating the bullying.
Excellent. Let's move to the second trans-specific A. So denial of identity. What can we do as to create some protective factors to try to improve the lives of folks who have been denied or might be denied their identity?
Teaching and practicing in schools self-compassion, normalizing questions and being comfortable giving answers. Support groups for family. I know I've missed some, and I apologize to those I've missed.
Let's go to number 3. Caleb, can you advance?
As a child, I got very distressed by seeing others being bullied, but did not have the skills to help, so would run home and hide. So teaching children what to do and how to help would be great. Showing media texts in schools that show a variety of identities. More education about the consequences of denying trans identity.
And so Caleb has moved us on to number 3, which is expulsion from home. So I encourage folks to look at the screen as well, to read some of those. And then if you want to continue to add in the chat, that works really well too.
Language avoid ladies and gentlemen and gendered language when engaging large groups. Disney just announced that it's not going to use that language anymore.
So some of the things that we're seeing in the Google document are like funding for LGBT shelters. I'm guessing the rest of that was going to be not just for women or not just for youth. Family acceptance strategies, rapid rehousing programs, queer shelters, public education for parents and families. Those are great. Other ideas for expulsion from home?
Services in rural areas, not just urban. Trans-friendly youth support services like shelters and meal sites, foster placement with LGBTQ adults.
Yep, excellent. Caleb, how about number 4, please? So police misconduct. So what's up here on the screen, I'll read those off, and if people want to add more to the chat or the Google Doc, that's great. So what can we do around police misconduct? Better police training, safe community spaces to go to, talk to people, abolition. That's a great thing as well. Know your rights workshops and education.
Looking for alternatives to calling the police, conflict resolution and transformative justice. Initiatives to hire trans police. Community accountability, more restorative practices.
Excellent. Excellent. Let's go on to number 5.
Train community members to move in pairs, groups, and how to film or intervene when safe. I think other people have moved on with me. Go ahead.
Number 5 is microaggressions. So we might still be on the last one. We might be on microaggressions. Do you want to keep going, Lori?
Increase social services in emergency situations. I think we're kind of still on police in the chat.
Okay. Let's go back, Caleb, if we can, please.
Actually, I think microaggressions is good.
Okay.
Well, let's go ahead and do microaggressions.
Okay.
We'll move in the chat.
It works. So with microaggressions, what are some of those protective factors?
Before we go any further, Michael, could you please explain what a microaggression is?
Sure. This was the piece that Caleb read. So the microaggressions are the things that are not usually meant to be harmful, but are harmful. They're like comments like, oh, you look really good for a girl, or I would have never known you were trans, or those little things that are not intended to be hurtful, but really can dig in deep. And they can be much more severe than those 2 examples.
So an idea is starting a dialogue, asking why the person who did the microaggression thinks the microaggression was okay.
So some of what's on the screen for microaggressions is micro affirmations. I love that. Mindfulness, normalize how hurtful this can be.
Okay, well, I've got empathy for microaggression.
Calling in, affirming people in space in front of everyone.
Apologize if you mess up.
Being affirming and supportive and model.
Creating more community shared values and guidelines, and having plans for when those are broken.
Great.
Not ignoring the microaggressions. More education about microaggressions and other identities in schools and communities.
Allyship from cis people, so trans people don't have to always be calling stuff out. That's great. Let's move on to 6, please. So minority stress. That stress that feels really, really heavy for minority populations. What do people think around that for protective factors? Some of what's on the screen is policy advocacy, normalizing experience and naming it.
Something helpful I learned is that if I need to be corrected on gender pronouns, anything, say thank you, which in that acknowledges the correction, rather than sorry, which may make the person feel they have to say it's okay.
Thank you.
We also heard support groups and community spaces.
Great. So also on the screen for minority stress is visual, relational, and environmental signs of trans nurturance to reduce hypervigilance. That is a fantastic phrase.
Social emotional learning and empathy for everyone from a young age, empathy building.
Mm-hmm. Other thing on the slide is skills building around emotional distress tolerance that is trans affirming. Those are excellent, excellent, excellent. How about number 7, Caleb, please? So legislated discrimination. What do folks think about legislated discrimination and what we can do to make trans lives better and healthier? I'm going to read the one that's in all caps that's on the screen, which is vote transphobes out. We do all have power with our votes, and we can use them wisely. Some of the other things that we're seeing on the slide is getting to know your legislators and speak to them about your priorities.
Center trans and gender expansive voices in the media.
Target misinformation. Term limits to get rid of old ideas. There's vote on the other side of the screen.
I go to rallies and protests ready to register folks to vote and or vote absentee. So there's somebody that goes with their tools in their hand. Build communities and processes that resist transphobic policies, creating something outside of the law. Grassroots organizations doing education. Crisis advocacy and support for trans folks during these times. How to make change. Run for office, get voted in.
Those are great. They're really great. Excellent. Let's go to number 8, just for the sake of keeping us on time for today. Oh, and Caleb, now your screen is doing the little boom, 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 boom. All right. So 8 is culture-wide discrimination. What do people think about what can we do around culture-wide discrimination? So it's on the screen. I'm just going to read a couple of them while you all think about adding to the chat. So abolish white supremacy and misogyny, teach respect, media spaces that support culture of affirmation, more funding for trans organizations, more funding for trans-led organizations, representation in all spaces, media, legislators, etc. Stop using sir, ma'am, unless if you know the person's gender identity. What are some other ideas?
Don't assume that certain pronouns correspond with certain gender identities. Tear down capitalism. Acknowledging that microaggressions are rooted in cultural ideas, not just individuals. Asking how we are all complicit in discrimination.
So acknowledging that microaggressions are rooted in cultural ideas, not just individuals, asking how We are all complicit in discrimination. No more gender reveal culture.
Occasionally scream into the abyss because facing this every day is rough as fuck.
Yep. That actually is a good place for us to transition off. You all can keep on going with it, but like, yes, I think we all need to have that outlet, whether it's screaming someplace or squeezing our pillows or whatever it is. So thank you for that reminder of ways that we can make a difference to restore ourselves. All right, so let me share my screen again. And if Caleb, you can give me a yes, you can see the screen, that would be helpful just to make sure.
Yes.
Thank you very much. So yay, way to go. Really good job. Bad on my part that it didn't work with so many people. I know that it works with 100 people or less, but we have more than 100 folks here. So way to go. I found this picture a couple of weeks ago, and it's like, I love the trans pride colors on this human. So it's kind of fun. All right, so I'm going to turn things over to Loree to talk about disrupting the ACEs with practical interventions.
Okay, so some of these are going to sound very familiar because you already came up with them, but let's go ahead. Let's focus a little more solidly on ways people can counter the negative effects of ACEs. This is just our cute little, one of our cute photos. The U.S. Centers for Disease Control and Prevention has studied child abuse prevention as a public health issue. They concluded that an effective intervention is providing safe, stable, and nurturing relationships, which they also called SSNR, because of course it's the government. While safe, stable, nurturing relationships was initially developed and promoted within more personal relationship dynamics, they are just as effective in professional relationships with clients as well. Safe relationships provide a welcome respite for a child or youth that is used to neglect and/or violence. So safety opposes neglect and violence. Stability, a stable relationship helps an abused child or youth experience the opposite of the chaos and unpredictability they may be experiencing at home. A nurturing relationship can counter hostility and rejection which that child may be feeling. Too often people think, but I'm only one person. What good can I do? In 2019, the Trevor Project surveyed LGBTQ youth and found that those youth who said they had at least one supportive adult in their life were 40% less likely to attempt suicide. So what specifically can you do? We have a long list of suggestions for you. Because victimization and rejection takes such a toll on self-esteem, two of the key needs trans and non-binary youth have is to feel like they matter and to feel hopeful about their future. First role is to always use their stated name and pronoun. Next steps can include expressing affection toward a trans or non-binary child or youth, saying something to them or within their earshot about your expectations for their happy and successful future, and including them in family or group activities. All of these can help counter negative messages and provide hope for the future. You can make your support visible. This heart reads, "Dear neighbor, I wanted to give you a big thank you for hanging a pride flag on your house. It truly gives me a sense of safety and pride in both the LGBTQIA+ community and my city's community. Happy Pride." Rachel Crowell has her back to us in this photo with author Helen Boyd facing us. It was her house where this heart card was delivered because they had a pride flag hanging on their porch. Beside flags, some other ways you can silently communicate support include bumper stickers, rainbow stickers, and safe space signs, t-shirts, and pro-trans buttons. Just watching this webinar is doing your part. Trans people notice when others pay respectful attention to trans issues. Now I'm going to hand it back to Michael to go over some resources.
Thanks, Larry. So we're going to move through resources relatively quickly and leave a little bit of time for some Q&A or discussion if people have it, or to end a little bit early. So we wanted to share a couple of the resources that we've been kind of referring to or have brought in concepts from, as well as some other things that you may find interesting or useful to you. So again, if you are not somebody that is familiar with the ACES study, the work that the CDC and Kaiser did, we encourage you to, when you get these slides, go to the URL that's on the screen and learn more about ACES. It's a really fascinating way to look at the world, I think, and it may be useful in your work or your practice. There is a growing body of work that's about resilience. So a lot of times we really focus on what's wrong, what's not going well, especially for what's going wrong for trans folks, what's going wrong for non-binary folks, how there are health disparities, there are all of these things. And until recently, there hasn't been much published that's really focused on what helps make trans folks resilient. How are trans folks resilient? What adds to the health, mental, emotional, physical, and spiritual health of people? So I encourage everybody to keep an eye out for those types of research, those types of books, those types of videos. There's 3 of them on the screen just as some examples of what's out there. The Family Acceptance Project was mentioned several times, and I know a couple of people even posted it in the chat. We strongly encourage you to look at the Family Acceptance Project. A lot of the material was geared towards, it has been geared towards lesbian, gay, and bi folks, not trans folks, but the material is all applicable to trans people as well. Laurie talked about All of Us and the All of Us study earlier. Ethical research can really make a difference, and there's not a lot of research on trans folks. There's a growing body of it, but it's really good if people feel comfortable and can trust the source. And not that you're going to want to trust me or Laurie or any of us, but All of Us is doing really good work in a really ethical way. And it's really good when trans folks get integrated into that big, large body of research so that we can look at if there are health disparities based on identities or other, biological factors or emotional or historical factors. Related to All of Us is the Pride study. So it's a Pride study and the All of Us LGBTQ+. So that's another resource that we encourage folks to look at. There are many things that are on the reachingvictims.org website. We were involved a few years ago with this really large Office for Victims of Crime funded project that looked at 8 underserved communities and how it interacted with violence and victimization. And there's quite a large LGBT section in this reachingvictims.org website, some of which goes into more details about polyvictimization and youth and risks and health disparities and all of that good stuff. So it's a really, really great website with lots of both trans and non-trans, LGBT and non-LGBT info. One of the palm cards that I really love, and we have boxes of them and we can send them to you if you would like to have some in your waiting room or some to give to your clients, are these little health cards that talk about trans folks and intimate partner violence and how it affects people's health. So Futures Without Violence was the initiator of these little cards, and we were a partner as well as the Gay and Lesbian Medical Association and a whole bunch of other folks in creating things that are really simple and easy to understand that help trans folks learn about healthy relationships in ways that they may not be getting elsewhere. So if you'd like some, feel free to email us or contact us and we'll send you some. We also encourage folks to keep learning. And whenever I bring up learning. I put our self-promotion on the slide because I encourage you to come and find other trans specific webinars that are about victimization and violence in those intersections. That's definitely one place that you can go. But I also really encourage people to go to where you don't know. So if you're somebody that doesn't know about immigration, maybe that's where you need to keep learning. Or what if you don't know about disability justice or restorative justice? Maybe those are the places you need to go learn. So I encourage all of us to be curious and to find the places that we need to enhance our knowledge or understanding of something. So I want to kind of leave us with this thought, which we've already started in that Google Doc that didn't work very well. But think about how you can uplift trans and non-binary individuals in people's strengths, their survival strategies, and their methods of thriving. If you want to put it in the chat, that's great. But I'd really like folks to kind of think about that as you leave today, about what you can do on that individual one-on-one level or bigger to increase trans people's strengths, survival strategies, and methods of thriving. So we have time for some questions if you have them, comments if you have them. You can ask them in either the chat or in the Q&A. Q&A will allow you an anonymous option. And if we don't have any questions, we can, like I said, check out a little bit early.
We do have questions and also comments. And before we start, I want to say that I really appreciate the fact that people were exchanging really useful and concrete information in the chat. I saw a number of connections being made, and I really appreciate all of you adding to what we had here. That makes it so much richer. I do have a couple of, I made some notes. Caleb probably has some notes as well about things that were said. Someone asked about statistics on emotional, verbal, and mental abuse by teachers. I would suggest you check with GLSEN, because GLSEN is the organization, GLSEN. I'm sorry. Yes, GLSEN. They're the ones that do really in-depth studies, surveys of kids in school. Someone did ask about the Pride study. Forge definitely recommends the Pride study as well as all of us. Someone asked, how old is NCLR's Born Perfect video? I wasn't able to find that answer, which is partly my technology problem.
Lori, I think it's a 2014.
Well, this project started in 2014, so it was probably not long after that.
Some of the people in the video look awfully darn young. And
someone noted that if you support trans adults, then they can model healthy living for trans youth. There was a discussion about secondary trauma, and do we have any research on what happens when what happens to people when the legislative discrimination is going on, or those kinds of problems? There has been some articles that have come out. I would try Googling them. I certainly saw some during the Trump years that did talk about stress levels going up. Also, I hate doing this because I often get it wrong.
Remove it back to your face a little bit, because you're, oh, it's not going to show. It doesn't, okay. It doesn't like you.
The researcher that did a lot of work on how legislative issues affect queer people is Glenda Russell. And she's, the book I have here is called Voted Out, The Psychological Consequences of Anti-Gay Politics. So if you want a deeper dive, you've got that. And then Michael, I was hoping that you could make a comment on someone who had some feedback on the materials we had on obesity. And clarifying what what we were saying in terms of, here it is. This is not a question, just a comment. When talking about fatness, please don't conflate fatness with poor health. Nutrition and exercise are very important, and that should, of course, be discussed, but it can be discussed without implying that fatness means you're not eating well or not exercising.
Yeah, that is excellent. If I did something to affirm that fatness and health are, I did not mean to do that. The CDC uses the language of obesity, which I absolutely hate that word. I think it's a useless word and it's stigmatized. And you are totally right that fatness does not inherently mean that somebody's unhealthy. So I'm really, really sorry if I spoke in a way that inferred that. I certainly, I hope that what I wanted to say, if I didn't say it, was that activity is important, whether it's, walking through your apartment or your house, but moving your body in whatever ways are possible is oftentimes good for our health. And eating well, I don't even want to call it healthy, but like eating a balanced or diverse diet is oftentimes helpful. And that, again, doesn't have anything to do with what our body size is. We can all be healthy at whatever size we are. So thank you for your comment. I know that's, again, I hope that I did not add to that misnomer that it's connected.
And also we were given an offer to improve the slide. So here's somebody walking their talk. Can someone find the URL for the All of Us study? I don't seem to have it right at my hand.
Caleb, it's backwards on the slide.
Oh, there we go. There's one of our participants. There's in the chat. Thank you very much.
And many of you have added so many great, everybody's going to add it, which is really, really super. So many of you have added really great resources. Like Laurie said, it's really rewarding to see that. And you can, if you want to save the chat, you should be able to click those three little dots that say more and save the chat so that you can keep all of those resources.
One more resource. Someone noted that PFLAG has great materials, including materials aimed at grandparents of trans kids.
Yeah. Caleb, were there other questions that you noted along the way?
Laurie actually covered most of them, but there is one that I caught earlier. It was, how does the gatekeeping and transition processes or trans relevant healthcare impact accessing services for trauma or other healthcare?
It's a great question. Laurie, would you like to answer that, or would you like?
No, I'm going to let you do that. You got a good one for that one.
Caleb, would you do me a favor and reread the question? Because I think it's a complicated question for those of us who are listening as well as responding.
Yes, I will also put it in the chat again, but the question is, how does the gatekeeping and transition processes or trans relevant healthcare impact accessing services for trauma or other healthcare?
That's great. It's a really good question. So what we're seeing more and more often, which is fantastic, is a shift from more of the standards of care model, which is very policing of trans folks, non-binary folks, and choices, to a more informed consent model. Insurance companies really like the standards of care model, which is very gatekeeping and hierarchical. But there's definitely a lot of negative impact from people not being able to live in their body and move in their body and access the healthcare that they need without jumping through hoops. So a lot of times people will feel like, what's the point? It increases depression. It increases a lot of things. It can increase trauma. Some of the standards of care require things like for trans men to have like vaginal exams before they can access testosterone, which is like totally not needed. So there's some things that people have to go through in terms of gatekeeping that can be very physically traumatic or emotionally traumatic, which then just adds to that polyvictimization cycle of having more and more trauma. That may not have addressed your question, but there's definitely a relationship to the gatekeeping mentality of things and how that's experienced as trauma, or how it's just a denial of care, and what denial of care feels like in terms of people wanting to access other forms of care. Really great question.
Okay, I have two more. Michael and Caleb, is it possible for us to capture the chat and send it out?
Yes.
Because people are saying they can't save it.
Well, Zoom has not been friendly with us today. So yes, we definitely have the chat saved, and we can share out all the resources. We'll compile those resources for folks.
Okay, thank you. And the other is rural liberal here. I find it frustrating when we talk about what we can do to improve things, and they do not include olive branches to quote unquote the other side. Where I live, there are far more of the other side than liberals who are inclusive, but excluding the other side will not help.
I love that. Thank you. That's a really great comment, and I'd like to comment back on it. Lori, I don't know if you have a comment on it or not.
I think she said what needed to be said.
That's good. Then I won't comment on it. But you're very, very right. So thank you for adding that in.
You mentioned gender segregated spaces undermining access and causing harm for non-binary people seeking care. Were there further findings regarding the ways non-binary people are affected by these things?
Yes. Yes. And it's 4 minutes to the hour. So yes, totally yes. Part of it goes to denial of identity, where folks who are non-binary who do want to access services are being someone that they're not in order to access. There's a whole lot of things. I would love to give a concrete, a very concise answer. And I think that would be really doing it a disservice, but I think non-binary folks get really the short end of the stick. That's not a good phrase, but it's really difficult for non-binary folks to be part of service systems that are so binary. And I'm aware that we have 3 minutes left. If there's one more question, let's do it. And if not, let's wrap up for today.
I think we're starting to get the thank you for this wonderful event. So I think we can close.
Excellent. Thank you.
Now one more, sorry. Will others be able to access this webinar online?
Yes.
And if so, for how long? I would like to encourage my colleagues to watch and listen. What a good one to end on.
Good one to end on. So Caleb and I are going to clean up any little bloops in this recording, and we will have it on the YouTube channel, our YouTube channel, in probably a week or so. Maybe by the end of this week, we'll find out. But yes, it will be available. Our YouTube channel, if Caleb, if you have that address, that would be great. If not, you can look for Forge Forward on YouTube. We'll also put it on our website. And then the follow-up email to this, which will come out in 2 days, we will compile that list of resources and send out the slides as well in that email. So yes, thank you, Caleb. See, this is what I said about Caleb. Like, Caleb's got all of the jobs and all of the things. So yes, recorded, yes, you'll get the slides, you'll get the resources, and you'll get our appreciation as well. So thank you for asking the questions. Thank you for being so interactive today. That makes my life very happy to see you all engaged and sharing resources like Lori said, really amazing. So thank you everybody for being here. Thank you, Lori and Caleb, and our 2 ASL folks who are fantastic. And we really appreciate your taking a substantial chunk out of your time today. So thank you and have a good rest of your day or evening. Good night, everyone.